it is day 149, and we were supposed to change our trays yesterday, and I realized after recording, and I was too lazy to do it because they're passive trays, so I was like, it's not that much of a big deal because there's not a lot of shifting going on. There's not, like, they're legit the same trays, just copy and paste, so I don't have to wear the same ones for a week. But let's go change it, because if you remember from last week when we changed our trays, this is the same tray from 2 weeks ago because they accidentally cut the wrong side for me. So let's go change it, and then I'll check in after this late night to see if there is any actual pain from the trays. Okay, I already brushed my teeth. I'm going to put my band back in. Actually, I feel like movement is maybe lessening. I'm not 100% sure on that, though. Don't trust me on that, because honestly, it's a lot of pain, and if I lose this tooth, I'm gonna be pissed. Pair of ultras. So, oh, there it is. I was looking for the button on the molar because I was looking at it like the bottom one. I was so confused. I was like, where's the button? I can't wear these if there's no button placements in it because I got fucking buttons on my mouth. But either way, let's get through stuff. Okay. Not any shifting, not any pain. Like I said, these are passive trays, but there is a tightness and a tension to it because they're a little firmer. Don't know if that's because they're fresh or if it is holding things a little more in place. But I'm gonna go with the fact that they're fresh. And bottoms, actually, this needs to be bent down. The passive ones have been doing good with this, but this one needs to be bent down. I'm not trying to have it lift my tooth any fucking more. So, this shit's gotta stay down. I'm getting very impatient with this process. Can you tell? Okay. I think I bent it enough, and I think it's not gonna lift so much that allows my tooth to be pulled up further. Because I think that's also part of the problem is the fact that this tray has been lifting and then this hook is pulling. When it stops doing the amount of shifting that needs to happen, or this area has no more room to go this way, then all it's going to be doing is pulling this up in a diagonal angle. And I think because the tray is not forced down on it, it's got all this freedom to fucking move. I don't know. I'm just hoping that things are okay for the next week and I don't lose my tooth, nothing changes. I called the ortho today. I just called them before recording this, and hopefully they'll let me know if anything is concerning or not. But yeah, that is tray change. We will check in tonight. Okay, y'all, nightly check-in, and it hasn't been too bad, but here, like where the tray meets the silver tooth, and here, really hurt. Anytime my teeth touch together, it hurts. We had soup for dinner. We had like corn chowder, so that was really soft, and that was really nice. And I'll probably eat a bunch of it tomorrow because I can eat it. And then, I can't even eat like chocolate, and I'm on my period, and it sucks. So it's been rough. This molar, though, I don't know if the movement's better or worse. They did not call me back today. I called them, but they didn't call me back. I did leave a non-urgent message, so hopefully they'll just let my doctor know that this is going on, so when she sees me next week at least, she can acknowledge it. But yeah, so today hasn't been the most pleasant, but it's a passive tray, so there's not much to worry about. I'm just more worried about losing my molar.